Hello, everybody. It's Dee Shaffer again, and I'm here to talk about one of my books, and I'm going to try to keep this very brief. But actually, it's one of my top selling books, and to be honest with you, for the longest time, I was pretty surprised. I wasn't expecting that. But then after, looking at reality, it sort of makes sense. So I'll explain that here in just a little bit. But this book is for nurses, and it is called uh, Charge Nurse Leadership Academy. And I want to talk about this book and sort of how it originated. But basically, my career has been predominantly in healthcare, and I've been a CEO, administrator, executive, healthcare executive for years. I'm not going to talk about how many years, but quite a while. And I, of course, through my career, I've worked with a lot of nurses and a lot of clinical staff. And um, obviously, if you know anything about the healthcare industry in America, you know that there is a significant nursing shortage, and the healthcare industry is facing a major crisis with the clinical staff and the availability of clinical staff. So, healthcare executives are looking at ways to be extremely creative in order to recruit and retain um, quality nursing staff. So, you know, if you're in leadership at all, of course, you know the traditional reinforcement tools. Obviously, you want to make sure your staff is valued, that you create a culture of excellence, and that you hold people accountable to those standards and those kinds of things. You do the pizza parties, the donuts, the wall of honor, the thank yous and all that stuff. And that is extremely important. So continue to do those things. But, in the face of all of that stuff that good leaders are doing, there still remains a problem, and there still remains a big problem. And that is, how can we as executives and clinical executives in healthcare, how can we recruit quality staff, and then how can we retain them, because the competition is just so fierce. So when I was the CEO of an organization or a healthcare company, we had about 400 employees, and I want to say 2/3 of the payroll was nursing and clinical staff. So I've worked in larger companies. I've worked with, an employee base of 100. So I've had, experience working with nursing staff at varying different levels. And one of the things that we're constantly doing is root cause analysis, right? What is the root cause? And we can get to the root cause of the problem, then we have a better chance of fixing it and addressing it. So that's what inspired me to write actually this book. But it really started out not intended to be a book. It was intended to be a curriculum for the nursing staff that I was working with, because one of the limitations, or one of the issues that I was able to determine was happening, is if there was an issue with a personnel issue or something on the floor, on the nursing floor, what would happen typically would be, the upper management or the clinical leadership or whoever would swoop in and address that issue. Well, that's fine, because things need to be addressed. But in that process, what was happening was staff would go around the charge nurse and go directly to, the clinical leadership, or the clinical leadership would go directly to the staff if there was an issue. And at face value, that's fine. But when you break it down a little bit, what's happening is that you are circumventing that charge nurse, and you are, removing that person, that charge nurse's authority, and that their ability to manage the situation when you manage it for them. And then the staff knew that, and then that creates that cycle. So this book was originally written as a curriculum to really empower those charge nurses, to teach them, critical leadership skills to manage the floor and to manage their team and the people that reported to them. And I tried to write it in a way that was kind of an analogy of, you have a good nurse, they attend to a very critically ill patient. They attend to the needs of a patient who's frail, who has, physical needs, emotional needs, whatever. they do very specific things as a charge nurse to address those concerns. Well, the same is true. Those tools and those skills that they apply to the patient, they can also apply those exact same tools to their team, and then become a more effective leader and improve the culture and reduce the negativity and improve patient care and also improve retention and recruitment. So it's just a huge win-win for everybody. And, you know, nurses learn a lot of technical skills, and so they're extremely good at applying their technical knowledge when it comes to, you know, managing a sick patient. Um, and they're taught that, right? So they learn that. Leadership, really, I just kind of wonder where has the education been on leadership, because they have a lot of responsibility to manage and delegate responsibilities to their team members to apply certain skills and certain you know clinical uh, concepts or whatever, I'm sorry, but their clinical expertise to the sick patients, right? So there's a lot of leadership that goes into that, and they just don't have the education or haven't had the education. So this book is really designed to help the clinical leadership and the administration to kind of stop doing that, to stop taking over and be there in a more supportive role and empower the charge nurses to manage their team, so that there is more stability on the floor, and that tendency to circumvent the charge nurse, it gets reduced, and things can get problem solved, you know, more at the on the floor level or on the unit. And I think that is going to do a lot of, you know, very positive things. Number one, is going to improve patient care. It's going to reduce negativity on the floor. It is going to, you know, produce it's going to be much better for the entire healthcare institution's bottom line, and it is certainly going to help with recruitment and retention. So this book is just really intended to help leaders, executive leaders, clinical leaders, give this resource to their charge nurses to empower them in a leadership role so that they can learn to develop those leadership skills. The other thing about this book, it is extremely brief. It's not lengthy at all. I don't like to read, so, you know, I like to write. I don't like to read. So if somebody gave me a thick novel, I'd be thank you. I'm not going to do that. But this is very, very easy. It helps the nurse understand how to apply their skills and generalize that to their team and the employees that report to them. So I know I've had some administrative staff order several books or several copies of this book, and they've given it to their entire clinical team. And I've heard nurses tell me that, man, I wish I would have had this, you know, a few years ago, kind of a thing. So I don't know if it's for everybody, but I think that, again, it is a very quick, brief resource, and I think that it's packed with a lot of helpful ideas and concepts that people understand and can you know, grasp. And it is going to be beneficial to everybody, the patient, the facility, the healthcare institution, the clinical staff, and also the financial bottom line. So anyway, I strongly encourage you to take a look at this. If this is going to be beneficial to you in your career, or people that you work with, it would be a nice gift. The other thing, if I've had some requests to do some public speaking, so if this is something, a presentation, it's possible that I could set up a presentation and just give a brief presentation. Just try to reach out to me if that's something that is of interest to you. I'd be happy to see what I could do to try to coordinate that. But this book is available on Amazon, Barnes & Noble, and Lulu, and it has a couple different editions. So anyway, Charge Nurse Leadership Academy by Dee Shaffer, and I hope that this helps you, and I hope that, you know, this is just my one small little effort to try to help this the nursing staffing crisis that we are facing here in America. So anyway, I hope this is very helpful to all of you, and I will see you again on the next video. Thank you.